My name is Elizabeth. My name is Nozivele Kamganamayaba. Welcome to my YouTube channel. If you are new to this channel, please make sure that you subscribe and join the rest of the family. If you are a returning subscriber, thank you so much for tuning in. I really appreciate your support. Today, I am bringing you yet another HIV related topic. But before I get into today's topic, maybe it is important for me to bring about context as to why it motivated me to do this video. So I've been very open that my mom and I are raising 3 girls. Upon my cousin's death, my mom and I took it upon ourselves that we are going to raise her 3 girls. The girls are now 15, 12, and 7, right? So at first, we did experience some challenges because we found out that we did not have all the right documentation. But lucky enough, we did have their birth certificate, so it was easy for us to register them at school. However, as time went by and the school was requiring, additional information such as a clinic card, what medication have they received, because mosmana clinics or NGOs usually do outreach programs at school, so they do require some information about the child to understand what they have received. Have they received all the immunization? What medication are they on, and so forth. But also, more importantly, I think the schools are now, I'm not sure whether it's this particular school or all the schools have adopted this, where each child has now a file that contains detailed information about that child. If that child has a caregiver or is adopted or has a legal representative or they do not live with their lantuga, with their parents, all that information is included in that file. So as we were applying, everything was fine. And then the school now wanted more information. Okay, we need the clinic card. The problem is that we did not have all that information. And it was a special case with us because, as I've said, my cousin passed away from an HIV-related disease, right? She was HIV positive. And we were not sure that, I wonder, did the girls receive sufficient support or sufficient care while she was pregnant, and also when the girls were born. We do not have all that information, and it's not like we could trace it back in terms of, what clinic what clinic was she going to. She could have been going to different clinics. So you can see how it was very hard at the beginning, and that is why my mom and I made sure that we involve as many people as possible. It's social workers that are going to assist us in legally adopting the kids, and also the healthcare system in terms of, are there any tests that need to be done? Please make sure that you provide the care that is necessary given the circumstances in which they were born into. But everything was good, and we received all the adequate support that we needed, and the girls were able to go to school and continue to go to school. The reason I'm sharing this story is because I know a lot of us find ourselves in these situations where a relative passes away and we end up raising those kids. Or in a case of a caregiver, umakulu, a grandmother, their daughter, their son, has a baby, outside of town. Let's say umama is in the Eastern Cape, the grandmother is in the Eastern Cape. I'm working in Johannesburg. We don't have family in Johannesburg, so when I get pregnant, it's very common. Hi, I'm not going to be able to take care of the child, so as soon as I give birth, I go and drop off the child at my mother's. And in some cases, some people are really irresponsible. They drop the child off and then you never see them again. The grandmother in most cases does not have adequate support where they know what to do with the child from a health perspective. Sometimes they can't read or write, so they can't even read umntana, what did they receive when they were being born, did they get all the right medication, even in a case where the parent is not HIV positive. So most recently, I followed a post that was shared by Dr. Tebelele. You remember him from a couple of months ago when I covered HIV and COVID-19 vaccines. So this was from a concerned parent where they found it very alarming that a parent's HIV status, whether negative or not, but I will assume the fact that they put it forward, it was a positive HIV status that was included in the Road to Health booklet. So the Road to Health booklet is a booklet that is given to moms at the clinic as soon as they give birth. So it highlights everything about the child, what medication they were given, when they were being weighed at a particular date, how much were they weighing, and it highlights different milestones of a child. Yeah, mom. So there is also a section in that booklet. I took it upon myself to research it and have a look in terms of how it looked like and what information it contained. So in one of the pages, definitely it does highlight whether or not the child was exposed to HIV at birth, and whether or not the mom or the parents are on ARVs. But I will assume it is very specific on the mom, because if the mom is breastfeeding, then that can affect, the child. So there were different views about all of this. On one hand, people found it very irresponsible because that booklet can be, let's say, it's a begin at home, and everyone may have access to it. And because everyone may have access to it, they may also be exposed in terms of the parents' HIV status. So why is it that the parents' HIV status is included in that booklet? And people are saying that, what if you are not comfortable in telling your family and then they find out like that? And then also using the example, earlier that I mentioned, in a case where the school is requiring you to include, the booklet or a clinic card as part of the application yomntana, so that it can become part of their file. How equipped are our teachers in handling such a situation where they find out that the parent is HIV positive, and worst case scenario, subsequently the child is also HIV positive? It's a valid concern, because now, to be honest, if I was not this comfortable about sharing different aspects of my life living positively with HIV, I don't think I'll be very much comfortable to really forward such information to strangers, to be honest. And some of us live in very small communities, Betuna, and our teachers are also human and they also live amongst us. So how sure am I that the information there is going to remain private and confidential? And also, how equipped, once again, are our teachers in handling such sensitive information? But there's also another side to the coin. So I spoke to two friends that happen to be nurses to better understand, obviously, from their own perspective, but is this something that they've dealt with, and how have they dealt with it? Because I've come to realize once again, I also come from a very privileged point of view. I've never had to go to a clinic unless it's for someone else. Ever since I was diagnosed with HIV, I've always been on medical aid. I've never been in the forefront of receiving really bad treatment from government officials, particularly in the health sector. My information has always been private. unless I willingly, share that information. So it has been very important that as I share my journey, I also share from different perspectives, and in this case from someone who does not have a medical aid and has received already bad treatment perhaps, and is afraid that this is an additional thing where I feel I'm not protected as a South African citizen in this case, and my HIV status is not protected, which goes against our South African constitution. So one friend said, Nozi, we deal with the Road to Health booklet. It helps us in the regard, once again, it provides us a whole holistic overview of the child and how the child was born and to what situation the child was born. But also we do encourage, it depends from one nurse to the other. Tina, this friend of mine is in the Northwest. Tina, definitely we tell the parent, but listen, we do realize, people may have access to this booklet. And there's sensitive information, particularly about your HIV status. So you can tear that page out. But as long as you make sure that every time you visit the clinic or the doctor, that page is included. Once again, you can tear that page out, but as long as you make sure that every time you come to the clinic, that information or that page is included. And then the other perspective that I got from another friend who is in the rural areas, I loved her honesty, because she comes from a point of view where she says, hey, Nozi, we really struggle. And the introduction of that Road to Health booklet was so important for us, because I deal mostly with grandmothers, with caregivers, and not the parents. We deal with kids that are sick. We deal with kids that were infected at birth. And in some cases, we find out about sometimes their HIV status when they get sick. And we need to do all these various tests to understand what is happening with the child. So that booklet to us has been a saving grace, because immediately when something happens to the child, we know we can reference what is in that book. And we take off the responsibility and the load of the caregiver to understand what is happening with the child. So I was following the post, and it was so interesting for me to read different perspectives. But one thing I could sense was the fear, that was coming from the parents, particularly parents that may be HIV positive, but status said to bethuna masingaveli nje saziwe nangubani, which is very fair. But I'm hoping with this video, it also provides you with another different perspective, that at the end of the day, it is all about the well-being of the child. And we can definitely put mechanisms in place to make sure that the parent is still protected. As I've said in the booklet, you can tear that page out, put it in a safe place where no one has access to it. And then when you go back to the clinic, making sure that that page is included. In conclusion, you know that I'm one person that advocates for the protection of people living with HIV. The fact that you can't go around disclosing people's HIV status, okay? But in this case, given my history with my cousin and the 3 girls, I just don't want to think about the worst case scenario if we had not received adequate support to care for the girls. From a social worker point of view, but also from the health officials. Given my cousin's history and how she passed away, is it necessary for the parents' HIV status, whether positive or negative, to be known in that booklet or to be included in that Road to Health booklet? Definitely yes. Now, how do we protect it is what we should focus on. So I hope this video has been very helpful. Thank you once again for joining me, guys. Until next time, bye.